now what happens when a patient comes to us for a bariatric surgery? There are a lot of patients now, they have enough information all around, people read online. A lot of patients already know about bariatric. So what happens is, when a patient comes asking for a bariatric, it's our duty as a team, I'm not saying as a doctor, but as a team, to understand the various problems that the patient is already having. Let's say a diabetes, let's say a menstrual problem, let's say a breathing problem, let's say a knee pain. So we need to understand the entire spectrum of what are the, not just obesity, but the associated problems need to be understood very well. Then the lifestyle of the patient, the eating patterns. Is the patient a vegetarian or non-vegetarian? The physical activity of the patient, how active the patient is. Or because of knee pain, back pain, are they really able to walk? Is their sleep pattern good? Are they very anxious, stressed kind of personality? All this needs to be understood. Why? It's just not about operating. We need to help the patient improve their lifestyle. Because as I have put it very clearly in one of the earlier videos, making them live a healthier life is what more important, and not just weight reduction. So it is just not surgery. Helping them to tailor all this is very important. So once all this is understood, we do a detailed evaluation looking at, is the patient clearly fit for the surgical procedure, for the anesthesia standpoint. Then we see what type of surgery will be best suited for the patient. Because bariatric surgery does not mean a single operation. There are many types of operation, starting from a sleeve gastrectomy to a Roux-en-Y gastric bypass to your duodenojejunal bypass, a mini gastric bypass. There are different operations that are done in the stomach and the intestines. But how do we decide which is best for the patient? Depending on these different conditions, which I've already told you, the medical conditions they have, the lifestyle that they have, then based on the different investigational reports that we have, we try to tailor make the right procedure for the right patient. One procedure cannot fit every patient. You have to suit that right. This is where, as a surgeon, as a specialist bariatric surgeon, we play a role. Because we have, at GEM Hospital, we have done some of the largest number of international publications in this regard. And also, we have written books that have been accepted as textbooks around the world. We are a teaching institution. We have exactly know which will suit right to the which patient. And when that is done in the right way, supported by the right supportive team in the terms of the anesthetist, the intensive care specialist, with all the support, we will be able to see the best suited procedure for the patient and also aid them in early recovery. Because usually the patients are fit to go back home, and believe me, in 24 to 48 hours. Because that is how we have built our anesthesia and intensive care team. The recovery is very, very short and pain-free.